let's say you do one or two clerkships, and then you're doing one or two externships, and a total of 4 or 5 experience you have in your hand.
And so, as according we are talking about the research, like what is the ideal time when a candidate or a student or a medical student or after graduating, what is the like perfect time or ideal time according to you when he or she can consider starting or getting involved in any research program or any kind of individual or meta-analysis or statistical analysis?
I think second after your second year, you should have a good understanding of basic medical science. Like, um, you know, you probably are done with your microbiology, you're done with
Yes.
your pathology,
Mm-hmm.
physiology. You know the human body, how the literature is, So after second or third year, you can right away scoop into studies. There's no perfect time. Even I've seen some people. I know some US graduates whom I'm in contact with. They start their research studies, involving into research studies right in the first year, in their summer. So, like when they have a summer break, they get involved with residents who are conducting studies. So, in order to get research, you need to connect with people. You won't get research sitting at your home. You need to
Mm-hmm.
go to the facility, you need to see patients, you need to meet with HODs, you need to meet with residents and put yourself out. Once a resident feels that, okay, this person is really interested in the concept, in the study, in the topic, then he or she would definitely, allow you to be a part of that study. And all these studies are basically done at institutes. So for me, my both of my research, mostly all of my research experience came from India. I didn't involve into research activity in US a lot. So my research experience was from BS Hospital in India. Dr. Daivat Shukla was my mentor. He's a rheumatologist, practicing rheumatologist in BS. So I involved in two of the biggest studies that were being conducted in India. One was HIV, a novel antigen they were
Mm-hmm.
trying for the treatment of HIV. It was a single oral therapy. It was a single drug. Currently, it's like a TLD, tenofovir lamivudine kind of regimen that we use for HIV. But it was an interesting study which was examining a new chemical entity. Its name was HRF 10071. And I got a lot of first hand experience how the study is conducted. Like there are site management organizers who are a separate body. Uh, they function in accordance with, and then there are principal investigators who are essentially MD physicians who are in charge of that study and take care of all the adverse effects, minor adverse effects and severe adverse effects that come out into the patients. And you get to see a lot of consents being taken, how the consent for the patients are taken. How do you oral consent and like verbal consent as well as written consent, how they are taken. So I
Mm-hmm.
was like, we were also allowed to take those kind of consents for a few patients. Then we were also allowed to take blood draws for those patients. So when you are in the process, you get to know a lot how a study is conducted and how the practice of medicine, evolves over time. How, just rather than just clearing steps and then doing rotations, it's basically everyone is doing that, and anyone who has a financial stability can opt for this journey. So it's pretty much generic. But if you have research, it's like you are putting yourself out and telling the match whole match process or the programs in the US that you are a candidate who's interested personally in this subject. So both of my research
Mm-hmm.
papers were case reports. They were not
Okay.
studies.
Mm-hmm.
The published work of mine were case reports, and I myself, gathered a team from NHL, medical students from NHL. We, just teamed up and took rare case presentations and just put that on. Uh, published. We published our work on Curious. It's a good journal. It's an open source journal which allows medical students to, publish their work. So we did experience a lot of failures. When I was in US, we tried to write case reports on a patient who was having autism and he was experiencing repeated cyclical seizures. So we tried to publish that, but we failed. So after one or two failures, we realized what works, what doesn't work, and there is a monetary part to it also. You need to pay for publishing those articles. But surprisingly, the second publication that I have, the most recent one, was a free publication. We didn't pay a penny because it was so properly structured. They allowed it to be published as free on Curious. So you do have that opportunity for case reports at least. So
That's very
you
good.
need to just connect with right people. Once I connected with Dr. Daivat Shukla, I knew that okay, this is the way you can write papers, and actually you can go ahead and take that risk of spending that $280 and you know just try to publish your work. How to manage each paragraphs,
Mhm.
and you can use Google Docs. You can add the emails of all your team members on Google Doc, and you can start working on a project. You can allot specific work. Like we divided our work in terms of paragraphs. So one person was responsible for writing an introduction, one person was responsible for writing the discussion part, the other one was just collecting all the slides of the images, like microscopic slides of the images, and several patient related details which you present in terms of the case presentation part of that article. So you need to divide the work. And I was like first author in my first article and second author in the second one. So I was responsible for curating everything and finally giving it a second look, refining it. We didn't use any editors. We just did everything on our own because we had good mentors again.
Yes.
So once I edited everything, I showed it to my mentor, and he was like, "Okay, you know what? Do this and that." So when your article goes into peer review part, it gives you an edge. Your article is very refined if you have a good mentor. That's why never do research alone sitting in a room. Go out, reach out to your mentors, residents, or consultants, HODs. Just don't be scared to put yourself out. A lot of FMGs, especially, I feel like they are really scared because they don't know the system. They face a lot of narcissistic
Yes.
medical professionals who just want to suppress you, but it's
Yeah.
okay. Tell them that it's okay. You are narcissist, okay. But you know what? Just tell me this, tell me that. If you ask 4 or 5 questions to them, they'll know that okay, this person is really interested, and they'll drop their narcissistic behavior and they'll start helping you. So I think put yourself out. Yeah.
So how can like well, let's say how a noob student can find a place or opportunity like to initiate the research process?
So let me ask you a question. What concept do you like the most right now? Like if I ask you like what topic you like the most
Like cardiology, I like the most.
in cardiology, what specific part you like?
Cardiology, like this heart failure conditions.
Okay, so try first of all go to PubMed.
Okay.
PubMed is open source articles
Yes.
library
Mm-hmm.
which has a store of all those articles. Even Google Scholar is a very good tool.
Yeah.
So go to Google Scholar, go to PubMed, use keywords. Let's say you want to have, let's say there is a case where you know you're interested in a concept where you're using sacubitril valsartan combination, and
Mm-hmm.
that is impacting the BNP levels, that just
Yes.
falsely increases the BNP levels. So you want to understand that concept. So go to PubMed, type in the keywords, and you'll get a whole list of articles.
Okay.
Scroll through the articles, read every article. That's the basic ground zero where you can start yourself sitting in the room. That's the first step of research. Like
Okay.
you can scroll through the articles, you get the system how each article is written, right? So you'll get the basic infrastructure of it. So there's a title. So title just drives you in. It compare research articles with movies. So title is the trailer. Introduction is the first leg of the movie. Discussion is the climax.
Yes.
Conclusion, discussion is the climax. So related to movies, and try to see it as an episode. Like when you're reading one article based on that concept, you're watching episode one.
Okay.
Then you scroll through another article, you're watching episode two of that. You're
Mm.
watching episode three of that. Then you'll get the story. You'll understand the concept from core. And then what you're doing is you're researching about the concept, but you're actively also understanding the process, how the article is written.
Mm.
You won't even realize at that moment where you finally know how to write a case report, how to conduct a study. Like to write a study into a publication is way tougher than writing case reports. Case report is just another case that you are presenting to the world.
Mm.
Like if your consultant says like tomorrow I want you to select a patient who has acute congestive heart failure and is also taking ACE inhibitors and how it is impacting the patient in developing AKI. So that is a concept. You find a patient and then you present. It's the same thing. Case reports are the same thing. And case reports are easily achievable and it is considered a publication. So you can start off with case reports when you're in med school, and that way you will have access to a lot of publications on your CV. And then when let's say you graduated finally, you have at least one or two case reports. Then when you meet mentors, you can at least say you have some work to show. Like,
Yes.
see, I am interested, I have a few publications, but I want to take it next level, and I want to be an author in a study or something like that.
Mm.
See, there are people, I get messages and DMs from Twitter and Instagram every day that, hey, are you conducting any study? I'll pay you $100 and just put my name on it. Don't do that, because if you do that, they'll put your name way behind. Like they'll put fourth or fifth author, and when you'll finally get an interview, they'll ask you. I was asked about my research in my interview, and because I owned those articles, I was flawless when I was explaining those articles, and they knew about it. They could
They
recognize
will know.
that.
Definitely, they will know.
Yeah,
Their experience, they are
they will
sitting
know.
under you, they will know.
Exactly. And you'll fumble a lot if you just put your name on it. Even if you go revise it 100%, you won't know the structure because you've never read
It's not
articles. You've
your
just
work. You will definitely fumble a lot.
Yeah. So the proper way to approach it is just go to PubMed, choose your choice of interest, topic of interest, and
Mm-hmm.
then just use proper keywords. Keep finding keywords is main. Like we use hashtags to find posts on Instagram
Yes.
and Twitter. So keywords are the hashtags of article world. If you use right keywords, you'll find each and every detail of what's out there. Some articles, I agree, big articles are paid, but you can use third-party services like Sci-Hub. There's
Mm-hmm.
a website that's called scihub.se. It's basically like torrent of the research world. You can get free access articles from there. Some are free, some are not, but you can at least start reading articles and try to get the process of it. And once you know the process of it, your way of presenting to mentors, to even your co-interns or co-students, it will change the career. It's game changing. So definitely, and since we are moving very fast towards the 2024 and the coming match cycles,
Yes.
USMLE journey is definite. The match process is definitely demanding publications from students. That's what
Because
I'm
it's
seeing.
getting tougher day by day, day by day. Match by match is getting tougher and more like more demanding.
Exactly.
Mm.
So I think, yeah, it's really important.
Okay, okay, sir. That's the very important point because most of us are very confused at where to start a research, how to find like most of us don't even know that the single most initial point to start any kind of research or any kind of case report or publication. So that's a very
I was
good.
in that place. I was in that place. In my first math cycle, I knew nothing about research. But
Mhm.
then when I failed to match, just I had to push a little bit. That's what you do, and that's the beauty of the whole USMLE journey. You won't match first time, you won't match second time, you won't match third time. But if you keep pushing, you are just increasing your CV, improving your CV. So there will be a time where you will definitely match. That's the beauty of this journey. You'll definitely match. If you keep pushing, you'll definitely match.
And then you said finally you matched, and many congratulations for that.
Yeah,
I
yeah.
came,
Thank you
I
so much.
came, I came to know about you from when I was interviewing Mudgal sir. He told at that time I was there only. So he told me that I have a friend from Odessa, and he cleared all of his steps and all that. And at that time I was very new in this whole USMLE journey. I just started only that time. So he was telling me that I have one of my friend, and that time I followed you. And
Right.
after that, my studies was going, and all of a sudden all this thing happened. Get back to home, coming to a different location and starting all of the thing all over again, because previously I was thinking to give my step one in 2023 only, this summers. But that 6 month of gap in at my home, that mental problem, that mental trauma, each and everything just shifted everything to the next year only.
Yeah, I mean, everyone watching this video just realize how difficult it is for FMGs. It's not
Yes.
easy. If you are
Not at all.
next time if you look at an FMG and just think things on your own, just don't do that, because you never know what kind of mental torture people are FMGs especially are going through. So
Yes.
more power to you, man.